it's Friday the 5th, it's about 20 past 4 in the afternoon, which makes it about about 3 days since my surgery. And I would say that this is probably, I was told sort of in leaflets and stuff that I got that the sort of swelling, bruising, inflammation, etc. would be maximal at about 48 hours. But I'd say it's probably more severe now at 72 hours than it was yesterday at 48 hours. So maybe a little bit more delayed than the average person. And it's mostly just kind of a real feeling of tightness on my chin. It kind of really feels like there is something quite kind of big and bulky beneath the skin there, and just kind of all over my neck. It just feels very very swollen and tight and just inflamed. There's no bruising whatsoever though. there's, as far as I can tell, it's kind of hard to see because of all the stubble, because I can't shave right now until I think 2 weeks is when I'm allowed to shave again. But there's no noticeable bruising or discoloration whatsoever, as far as I can tell. But yeah, my whole neck is very swollen, and kind of visibly swollen as well. It's kind of just from my head to my shoulders. It's just kind of straight down almost. And it definitely feels that way. And if I kind of look down, I can kind of feel it. The inflammation kind of being compressed. That is a bit painful and tender. Speaking still feels quite strange. Just again, like my whole sort of lower lip feels quite tight and quite sort of like it's being pushed up. But then again, I think the inflammation on my neck is very pronounced. But I probably do have. I must have some amount of inflammation on the front of my face, where sort of around the mouth, and I would imagine that will sort of have an effect on my lips and everything. So hopefully once all the inflammation kind of resolves, I'll be able to, I won't have any sort of noticeable speech issues or anything. So yeah, just following all the instructions, taking the antibiotics, which for me is erythromycin, doing the Fusidin ointment 4 times a day, taking my vitamins, the prednisolone, some 4 tabs a day, and yeah, I haven't used the, so I've used my last diazepam now, and that was a half tab last night, so I don't have any of that left, but I don't think I really need it. To be honest, I think I probably fell asleep. I probably woke up and went back to sleep multiple times last night, and that would be long after that wore off. So I don't think it's really essential for me to fall asleep, to need that pill to fall asleep anymore. I was also given Celebrex, but I think I've only taken. I think I took 1 or 2 the night of surgery, but really I'm just kind of using paracetamol instead, because I don't feel that my pain is bad enough to warrant sort of such a powerful painkiller. So yeah, there's not really anything to say really. I suppose I'll check in tomorrow.